During this ASH 2022 meeting in New Orleans, I'm presenting about our latest results concerning the use of pooled fecal allogeneic microbiotherapy for refractory gastrointestinal acute graft-versus-host disease. These are actually the results of a large cohort from an early access program in France. I don't think I need to spend a lot of time to convince the community that treatment of severe GI acute GvHD is truly an unmet medical need, despite the recent approval of ruxolitinib. On the other hand, we do have some accumulating body of evidence about the benefit of fecal microbiota transplantation, with some very promising results in steroid-refractory acute GvHD. So here we developed an experimental product called MAT13, which is a pooled microbiota of high richness, high diversity. It's a sort of a full ecosystem containing the BT core, highly stable. You give it as an enema, and we could validate its feasibility, safety, and efficacy in a previous phase 2 trial called Heracles. So here what I'll be talking about are the results from 81 patients who were treated in France under an early access program that was authorized by the French regulatory body. And these were adult patients with GI acute GvHD with known resistance or dependence to corticosteroids or alone, or after failure of other lines of treatment, including ruxolitinib. So 81 patient, median age 58, the usual diseases, candidate for transplant. 84% were steroid resistant, 16% were steroid dependent. And of course, as expected, the majority, almost 90%, were those patients with grade 3 and 4 acute GvHD. In 59% of the cases, it was only a GI involvement, but in the other cases, we have other organs being involved. Another important feature is that the median number of previous treatment prior to administering MAT13 was 2, from 1 to 6. Of course, 100% received corticosteroids, but 81% also received ruxolitinib. A few others received anti-TNF-alpha, ECP, methotrexate, and many other treatments. Under this program, the patient received a median of 3 bags of MAT13 through an enema. The good news is about a very high response rate in GI acute GvHD, 56%, including 37% CR, 14% VGPR, and 5% PR. And when you look to the overall response rate, we're talking about 49% overall response, 31% CR, 14% VGPR, and 4% PR. And the results are quite amazing in the steroid-dependent GI acute GvHD, 92% overall response, 69% CR, 15% VGPR. And if we focus on the patients who were refractory to ruxolitinib in second line, this is the label for ruxolitinib, and who were salvaged with the MAT13 product, actually we have a group of 31 patients, and the GI overall response rate was 65%, including 61% of CR and 3%, one case of VGPR. So this is really quite amazing, because the response will translate into an increased overall survival in this group of patients. And actually, when we focus on the ruxolitinib-refractory patient, we're talking about a 74% survival at 6 and 12 months. And we can achieve these very interesting results with an excellent safety profile. And obviously, that provides the rationale to move into a larger phase 3 trial, which we have now launched in Europe, namely the ARIS trial, which is focused on the third line treatment of steroid-refractory acute GvHD. These are the patients with GI acute GvHD who are refractory to both steroids and ruxolitinib. So in summary, clearly very promising, very exciting results that can be achieved through FMT, especially with this pooled allogeneic product called MAT13, which is proving to be highly effective and safe in this very difficult, very hard to treat group of GvHD patients.